A drug is the active component in a medicine. It is a chemical that binds to a critical signalling molecule on or in a cell and changes how the cell behaves. The target molecule is usually a protein, and there are four main molecular targets that therapeutic drugs employ: enzymes, G-protein coupled receptors, ion channels, and nuclear receptors. The binding site is referred to as a receptor for the drug. Receptors may be found on the outside of cells, such as in proteins of the plasma membrane. When a drug with a structure that complements the receptor approaches the cell, it recognizes the receptor and binds tightly to it, much like a key fits in a lock. Receptors can also be found in proteins located inside the cell in the cytosol. For a drug to interact with this type of receptor, it must be lipid soluble and able to cross the lipid membrane. But once there, it interacts with the receptor in the same way, like a key fitting a lock. In general terms, drugs can act as agonists or antagonists. Both have a specific molecular target or receptor. When an agonist drug binds to its receptor, it activates it. This stimulates the downstream biochemical pathways that lead to a change in the behaviour of the cell. In contrast, when an antagonist binds to its receptor, it inhibits stimulation of the signalling pathways, thereby preventing the receptor protein from having its usual effect. Drug molecules that interact specifically and selectively with receptors are generally known as ligands. Let's start by looking at agonists. The more agonist molecules present around a group of receptors, the greater the response will be. So, the response increases with the drug or ligand concentration. When plotted as a graph, the response starts at 0%, which is the baseline activity. It rises steeply as the concentration of agonist is increased, then levels off at higher concentrations when no further response can be achieved. This occurs because the receptors are fully activated. This type of curve is known as a rectangular hyperbola. Concentration response data are more usually plotted with a logarithmic concentration scale. When the concentration response curve is replotted with a log concentration scale, its shape becomes sigmoidal or S-shaped. This makes it easier to read off the concentration at which the response is equal to 50% of the maximum. This value is known as the EC50 and is an indicator of the potency of an agonist. It is especially helpful when comparing the potencies of different agonists. Not all agonists are equally effective at producing a response once bound to the receptor. This can be seen as a smaller maximum response. The agonist that produces a full response is known as a full agonist. The agonist that produces a smaller maximum response is known as a partial agonist. There are even agonists that produce a response in the opposite direction. That is, they reduce the baseline activity of the receptor below 0%. This type of drug or ligand is known as an inverse agonist. Although it inhibits activity, an inverse agonist is distinct from an antagonist, which inhibits binding of an agonist but does not produce any response itself. The ability of drugs or ligands to activate the receptor and produce a response is known as efficacy, and it's measured from the maximum response in a concentration response curve like this one. As shown in this table, a full agonist has an efficacy of 1, a partial agonist has an efficacy between 0 and 1, an inverse agonist has a negative efficacy, and an antagonist has efficacy equal to 0. So, antagonists have no effect by themselves, but they prevent other ligands from binding. Most clinically used drugs act as antagonists. In fact, most are competitive antagonists, meaning that they compete with the endogenous agonist for its binding site. To illustrate how they work, we have a cell here with a receptor on its surface. If we add some agonist molecules, they bounce around randomly and every so often get close enough to the receptor to bind to it. As an agonist binds, it activates the receptor, then leaves again to be replaced by another molecule, which activates the receptor again, and so on. Now, what happens when we add a competitive antagonist? Like the agonist, when the antagonist gets close to the receptor, it binds, but it does not activate a response. Notice that the antagonist stays bound to the receptor for longer than the agonist molecules. That is because antagonists normally have higher affinity for the receptor. When the antagonist is bound, agonist molecules cannot bind to the receptor and cannot activate a response. So the antagonist blocks the effect of the agonist. But if an agonist molecule reaches the receptor when it is unoccupied, it can still bind and produce a response. In this way, the two drugs or ligands compete for binding at the receptor. Not all antagonists are competitive. Some act in a non-competitive manner. This can occur by two separate mechanisms. Firstly, a drug can bind irreversibly to the receptor, permanently blocking it. But most non-competitive antagonists act allosterically. That means that they bind to a distinct site on the receptor protein from the agonist and work at a distance to prevent the agonist binding. This cartoon illustrates what happens when a non-competitive antagonist is added with an agonist to its receptor. The binding of the antagonist drug B causes a change in the shape of the receptor, so the binding site is no longer available to the agonist. As with a competitive antagonist, the agonist can still bind and produce a response at unoccupied receptors. Competitive and non-competitive antagonists can be distinguished by their different effects on the agonist concentration response curve. The red curve shows receptor responses to an agonist applied at increasing concentrations. The same agonist applications were then repeated in the presence of a low concentration of a competitive antagonist. You can see that it now takes higher concentrations of the agonist to produce the responses achieved when agonist was applied on its own. As the antagonist concentration is increased, it takes more and more agonist to achieve the same response. So the agonist concentration response curve is shifted to the right. Notice that the curves are shifted in a parallel fashion and that the maximum response is unchanged. So, no matter how high the antagonist concentration gets, the agonist can still overcome the inhibition. You just need to add more agonist. Non-competitive antagonists affect the agonist concentration response curve differently. When the agonist is tested in the presence of increasing concentrations of the antagonist, there is increasing loss of receptor response. The slope of the relationship becomes shallower and the maximum response is suppressed. That is because the two drugs bind at different sites, so the block is independent of the agonist concentration. Another type of antagonist is a functional antagonist, sometimes also called a physiological antagonist. Functional antagonism is seen when two drugs acting on different receptors have opposing physiological effects. In this example, we have two droppers containing solutions of drugs. The one on the left contains pilocarpine, which is an agonist at muscarinic acetylcholine receptors. The dropper on the right contains phenylephrine, an agonist at alpha-adrenergic receptors. When we drop pilocarpine into the eye, it activates muscarinic receptors which promote constriction of the pupil. When we put drops of phenylephrine in the eye, it activates alpha-adrenergic receptors which mediate dilation of the pupil. Now, if we put both drops in the eye together, nothing happens. One drug appears to antagonize the other.